Hi, Dr. Jenna Andrade, the Active Persons Chiropractor, and today I am sharing one of my favorite homework exercises, and it is the seated glute stretch. So the seated glute stretch is something that I use with patients that are having discomfort or pain down the leg. They're feeling a lot of tension in the glutes or the butt muscles, or they're having some pain or dysfunction that is coming more from that pelvic area. So this can be really helpful for them to use in between visits to maintain the progress that we're making and to be empowered to have some tools to help them to relieve that discomfort, pain, and tension. So it's a pretty simple exercise. So I'll walk you through it and then I'm going to demonstrate it. So the first thing that you need to really think about is the surface that you're doing it on. So you're going to be sitting, and I want you to be sitting on a nice firm surface. So think about a dining room chair that has some nice support, and it's a firm surface that you're not going to sink into. So I don't want you doing this on a couch or a lazy boy or a bed, because that's not going to provide the support that we need. And then the next thing we need to do is really sit at the edge of that chair or surface. We're going to sit up really nice and tall. Whatever side we want to stretch, we're going to cross that leg over the opposite knee. Again, keeping those shoulders back and down, nice posture. Then I'm going to have you lean forward, but I want you really bending from the hips. So we don't want you to be stressing your lower back while you're doing this. So this is all movement from the hips, leaning forward into that leg. And then you can get an additional deeper stress by leaning into that arm on that side and really putting a little bit more pressure into that knee to your tolerance. And where you should be feeling this stretch is here in the glute or butt muscle and even onto the side of the hip. And I want you to hold that stretch for a minute or two, which is not very common for people. We are typically taught to do it for maybe 15 to 20 seconds. So that's great for warming things up, for improving blood flow, but we're looking to actually decrease the tension and really get that muscle length change. So holding it for a little bit longer can be more effective to do that. So I hope that you guys find this stretch really helpful. Thank you, and I'll talk to you soon.